Hello and welcome to another Pocket Physio video with me, Paul, where we break down complex conditions so that you can stay healthy, informed, and pain-free on the go. Today, we're talking about tennis elbow, uh, why it's not actually exclusive to tennis players at all, what it is, and what you can do to manage the pain if you're suffering from it, and just get informed. So let's have a look here initially. So once again, we're here with my little anatomy diagram, which I love because education is key here. So first things first, let's look at the anatomy and let's just explain this a little bit. So lateral epicondyle, or the tennis elbow, is this region right here. So this is the bone here, and you can see just on the outside there, this is the region that we're looking at here. And what you'll notice when I bring in all the muscles is that you'll see that there is this sort of common tendon, common area that they're all attaching on, and that is what we call it. So there is the common tendon of these muscle groups of the forearm starting on the outside of the elbow. And these tendons originating here, their goal is simple. Bring the wrist up like this, and then also turn out the way. So what we would call extension and supination. Okay, so that is the goal of all of these muscle groups here. They're all coming over, attaching onto the back of the hand and performing those actions. And they all have this common origin section right here on the side of the elbow. We call this pain tennis elbow because, yes, tennis players do get it, but it's actually common in many different fields and it's not exclusive to tennis players at all. But it is an injury that is usually comes from repeated stress and strain, which is why it's quite common in tennis players. So obviously with your dominant hand constantly playing, it is common. But other racket and arm-based sports, you'll find that a lot of people get it as well as general hands-on work. So people who are using drills frequently and using their arms a lot in their day-to-day life, they suffer from it greatly as well. And then also just trauma. If you bump it, you can irritate it as well. Sometimes if you're in a road traffic accident and then your arm, outside of your arm, hits something, that's another reason that you may get it. But yeah, it's a really, really common injury, particularly in those who are using their arms quite a lot, whether that's with their sport or with their work. All right. The healing times vary greatly because, like most things, there is severity to it. So, pain from the tendon can mean lots of things. It could mean just some localized pain and inflammation because you've done too much, all the way up to the tendon is actually starting to degenerate and the pain is starting to really, really, really throb and ache. So there's a lot of in between there, but you're looking at anything from a few weeks to 6 months generally. And the best treatment option is physiotherapy, conservative, eccentric exercises, which basically means controlling the downward movements. And we'll go into that a bit later on. And yes, those are the main options. The alternatives to physiotherapy when you're not are injections, which so you can get steroid injections and plasma injections into the tendon, which are really, really good in the short term if it's very painful. So if the pain level is super high, then they're a good option. But otherwise, they are best avoided because long term they can lead to damage of the tendon and they can speed up the degeneration of the tendon as you get older, which means that you'll suffer more in the long term for it. So physiotherapy has been shown to be very, very effective on its own, and actually time. Just if you irritate it and you just give it time and try and avoid the aggravating factors, studies show that it generally goes away, especially up to a year. So you can do nothing and it will go away. So that's also important to remember. The exercises can help you keep on top of things, can help speed up that process, and can help you manage the pain more. But equally, they've done studies where it just told people this is what it is. Don't do this. Continue with this, and it still gets better. So this is a really common injury, but it's actually has good healing potential. And yeah, you're best off just with exercises and stuff. So yes, that's just a quick overview of the injury, the common causes, and what the best treatment options available are. And if this is you and you're suffering from it right now and you want to know specifically what you can start doing today, then stick around because we're going to jump over to our good old friend Fizzy and we're going to ask what we should be doing right now if we're suffering from this pain. So let's just jump over to the app and let's just start a conversation. What we'll do is we'll go through me typing in the questions and answers so that you can see kind of how it works, but I'm going to speed it up so that it's a bit more engaging. So we're just going to pause and go through that there. And basically what we're going to do is input all that information that we were speaking about there, where the pain is coming from, what it feels like, what the causes were, and then Fizzy is going to give us recommendations. And here we are. We've come to the conclusion, and you've seen it. I've just been asking questions, and then there's Fizzy telling me exactly what we've said. Lateral epicondylitis, tennis elbow. Good explanation here of why we think that is. And now let's see what Fizzy thinks we should do right now. Oh, and here we go. This is what Fizzy thinks we should do. We asked for some simple exercises and a way to manage the pain. We've got a wrist extension stretch and an eccentric wrist exercise. Again, that's what we were saying from the research was the best thing to do. And then also some information here on how to manage the pain. So we have a look here. Wrist extension stretch, good explanation on how to do that. Eccentric wrist exercise. Let's go. Find me a so that kind of sums everything up here with tennis elbow, what it is, what it feels like, and then now we know exactly what we should do if we're suffering from this. If you enjoyed this video, please give us a thumbs up, subscribe to the channel so that we can grow and help more people on the go. That sounds good. And yeah, if this is you suffering from this pain and you want to know more and you want to get help and you want to get back to what you need to be doing, just click the link below and book your treatment session with me and Fizzy today. Bye.